Kia ora, my name is Alison. I'm one of the Heritage and Research team from the library. Today I'm going to do this presentation on the influenza epidemic of 1918. It has been designed to give you a snapshot of this subject, not an in-depth look, but rather a perspective using resources from the Rotorua Library collections. Topics we're going to look at today include the point of origin and the news of the influenza, World War I, New Zealand, and finally Rotorua. So, the origins. News of the flu first came from Spain. This was because they were a neutral country during the war and they had no newspaper censorship. News that the King of Spain had fallen ill with the flu, even though he survived, was out, and it became known then as the Spanish influenza. The flu reached New Zealand a few months behind due to the distance from the epicentre. Historians actually believed that this came from North America, more specifically Kansas, where there were many pig farms, and their research suggests swine flu is more likely. Some 56,000 men were stationed at Fort Riley military camp for training. One of the camp cooks reported in sick with influenza, and within a fortnight huge numbers of men were reported as having the flu. Many of these men were shipped out to other training camps or home on their way to France. Once they arrived there, it spread like wildfire. Once it arrived in New Zealand in October of 1918, it was noted to affect mostly elderly and children. Later outbreaks were reported at boarding schools and military camps. Soldiers suffered the most because there were thousands of men sandwiched together at the military camps, and thus the virus spread easily from man to man. New Zealand continued to send soldiers to the front, however, and the virus mutated and became a killer flu. Auckland reported that there was an explosion of influenza across the city by the end of that October. A zinc sulfate inhalation sprayer was set up at the health department in Albert Street. More than 300 people had passed through the spray on the first afternoon, and advertisements for supposed cures started appearing in the newspapers, as seen in this little excerpt from a New Zealand Herald, care of the papers past. It is likely this strain of influenza came into Auckland aboard the troop ship Niagara, which was not quarantined when it arrived, and they were all allowed to disembark and go home. The reality hit with a forecast from Sir John Janiston. I have no hesitation whatever in saying that the cases of influenza have occurred in New Zealand. The acting chief officer, Dr. Friendly, travelled to Auckland from Wellington to see for himself what was happening and was appalled by what he found. Subsequently, he declared the influenza was a notifiable infectious disease. Some treatments. Suggestions were at best the same as for common cold or mild influenza. You must be in a well-ventilated, airy room to promote well-being. You must have good, nourishing food, and enough of it is desirable. The throat gargled every 4 to 6 hours with disinfectant. Carers must avoid inhalation of patient's breath, particularly when coughing, sneezing, or talking. The value of alcohol in combating the epidemic was said to be transient, with no enduring effect. As quoted in the Commission of Inquiry, there is no virtue more than this. Alcoholic excess invites disaster. Chill and overexertion during convalescence are fruitful of evil consequences. A Rotorua resident recalls the only preventative was a soft prenalable that was handed out. Oh, they were terrible things, he said. Had a lot of sulphur in them. So community transmission. Trained nurses were in short supply as most were still overseas in the army hospitals. This meant that patients were encouraged to stay home unless they were in critical condition. Rotorua patients who needed hospital care were separated by gender and race. Men in the isolation hospital, women in the St John's Church Hall, and Mauri from both sides of town in the Rotorua District School. For 6 days, the nurses, Red Cross volunteers and women of Rotorua were left to cope on their own. At this time, the isolation hospital reported they had 40 plus patients. King George, the 5th hospital, had 80, and at the school, 40 patients. These are some of the names of just a few who have died in Rotorua from the influenza. The actual number for Rotorua is recorded as 27 Europeans, 11 Maori deaths. However, Don Stafford records that anecdotal evidence is that there was a considerable number, and only those under care of a physician had been recorded. So the epidemic and how it affected our Armistice Day. Celebrations were very short-lived due to the epidemic. The official peace day was moved to July of 1919 throughout New Zealand, everywhere from the main centres and their surrounding suburbs to small towns and rural areas. Following advice from the government, most communities held their celebrations over 3 days, from the 19th to the 21st. Most also followed the format originally announced by government, which called for a Soldiers' Day, a day of Thanksgiving, and a Children's Day. Findings from the Commission into the epidemic. The first one being the spread of the disease was said to be spread by coughing, sneezing, and even loud talking across considerable distances. In the army camps, it was noted that there were 2 distinctive waves of the disease, the second causing the most serious cases and deaths. Unsanitary conditions and overcrowding in cities were also major causes of spreading the disease. Incubation was said to be 48 hours or less. Better and more timely communication was called for between health authorities in other countries. Public health law needed to be overhauled and updated to include new legal rights to the health officials at all levels. This included enforcing quarantine and inspections of private dwellings. Primary and secondary schools were also instructed to implement domestic science, hygiene, first aid and home nursing as subject for girls. These subjects were to be compulsory in secondary schools. And here we're just going to read a story from a well-known Rotorua resident.
November 1918 was a sad time for our family. I lost a brother and a sister within 10 days of each other. My brother, Sergeant Angus Carnahan, was a young soldier in Featherston military camp when the news of the Armistice came through. Though not quite recovered from the flu, he went into town to join in the celebrations, had a relapse, and died. My younger brother and I went by train to see our sister-in-law in Featherston and bring her back to Rotorua. I well remember that nightmare journey. All along the line, we saw funeral after funeral, victims of the epidemic. My sister Elizabeth here in Rotorua was expecting her second child, due in a month's time, when her husband and toddler daughter became ill with the flu. She worked hard to nurse them. On our return from Featherston, we found that she had caught it too, and her baby was born prematurely. The child was born a healthy boy, but my sister died a few days later. There was a widely held belief that no pregnant woman who became ill with the flu survived. My mother, who helped with the nursing in my sister's household and also did what she could for neighbours who were ill, did not get the flu, and I too escaped it. My brother-in-law had come home from the war in January of 1918 and had an outdoor job with the post office. His mother had died young, and after his father remarried, he had a bad time with his stepmother. When my sister died, he said he would never give her children to a stepmother, and he never did. Hats off to all the helpers who worked so hard during that terrible time. The doctors, the nurses, the retired nurses who came willingly back to duty, the young women of the town, and the good neighbours. Everybody helped.
Thank you all for your attendance. We hope you learned a lot from this Heritage Talk.